And on LaProfit, we have a very, very special guest, and this is India Fights Obesity. We have Dr. Prabhu Nesargikar, and he has touched patients nationally and internationally, someone with some amazing international experience. You are a cancer and bariatric surgeon, so giving us a wide understanding of how obesity works. Doctor, it's a pleasure having you here with us today.
The pleasure is all mine. Thank you for having me up here.
Dr. Prabhu, cancer and obesity, how far is this relationship going?
Well, I don't think it's far anymore. I think before people thought it was far away, but now they're actually like a DNA intertwined genes. And now it has been shown that now smoking is second. Obesity is actually the number one cause of cancer worldwide. The reason being, once you're obese, there are multiple cancers are linked with it. And now studies have shown that people who actually had surgery or have lost weight, they're much more less likely to have cancer compared to the normal population. So I think we obviously are fighting it on one front, saying it's a metabolic disorder, but now the second front is that is also an oncological perspective. So I think we have to stress on the point that going forward in the future, people should understand that being obese not only affects their health, just in metabolic perspectives, but also from a cancer perspective. And I think my interest in being an esophagogastric surgeon was this, that when I started doing cancer surgery, doing obesity, and so now I've combined both into one specialty, and hopefully I can do some meaningful work going forward.
Absolutely, Dr. Prabhu. You know, we are also battling cancer in India, and this is a great perspective, a new way of looking at it totally.
True.
Right? Doctor, also help us understand, you may have treated patients, and we understand the West, the East, it works differently, but in terms of transforming lives, they're all the same. Bariatric surgery definitely has the impact.
Yes.
So anything that you'd like to share with us in terms of transformation that bariatric surgery has caused?
No, I think two. So in UK we had a lady who had sort of BMI 46, obese, and she was struggling to have kids, and she was going through all this pathway for the last 1 year. Now in UK you have to literally wait, you have to struggle hard to get a ticket to get a bariatric surgery, but she eventually made it. And then obviously she was, I think, 35, and then she had the surgery, and then I think she underwent a bypass operation in a hospital along with our team. And then going forward after 1 year, we saw her briefly, and then after 1.5 years she came with a baby. And that was the most, because that's the reason she always wanted to have a surgery, was now it's shown that people who are PCOD or a bit infertile, having loss of weight can contribute to fertility. And that's one of the main reasons she was a motivation to go forward. And she had the baby in her arms and came to us, and that was shows that, when people have a positive motivation going forward and we can influence it in a certain way, then that was one of the reasons why bariatric surgery really worked. So that was very important for me. And the second was in Singapore. We had a patient who was 50 BMI, very super obese. I think he was 165 kgs or so, could barely move around, and then he had the surgery as well. And when you look at 1 year down the line, we should stop looking at short-term outcomes. When you look at 1 year down the line, when he was walking, and now he's a marathon runner, those things actually make your job as a bariatric surgeon much more fruitful and futile.
Alright, you've been hearing no all your life, and then suddenly it becomes a yes. Thanks to bariatric surgery. Also, since you have an international exposure, you'd understand how insurance works. And with IRDM making this amazing move, where we are going to have insurance for bariatric surgeries. Your perspective as a onco surgeon, as a bariatric
I think
surgeon.
it's actually, it's like, how they say, Bhagwan ke ghar mein dere ke andher nahi, like that kind of setting. I think it is a bit late, but I think it's actually good news that's finally arrived. Like in UK, obviously the healthcare is free. In Singapore, the insurance is covered, so most of the patients can access surgery, or before surgery, you want to access a weight loss clinic, they come at an earlier rate. In India, people were hiding in the fact, thinking that weight loss perspective, including surgery, they're fearful of the cost or the repercussions of having this. But I think if insurance has now come forward, it means there's a recognition of the fact that bariatric surgery or weight loss in general has a positive impact on life. I think that we should commend the insurance organization for that. But I think we should also have a bit of political will to push the people towards that feeling that, having a healthy life, we fight India together.
Absolutely. Dr. Prabhu Nesargikar from HCG, thank you for joining us as India Fights Obesity, and thank you for giving us a new perspective to it totally. Thank you very much.
I hope my small contribution helps.